it's not surprising to anybody that healthcare workers are having a hard time with COVID. And in the maelstrom of what this pandemic has become, a lot of them are starting to burn out in a profession where they probably had a high burnout rate to begin with. Rick Tytus is a doctor, associate clinical professor in the Department of Family Medicine at McMaster University. Joins us right now. Dr. Tytus, nice to have you. Good morning.
Good morning, John. How are you doing this morning?
I'm very good, thank you. Can you give us a bit of a perspective, even notwithstanding COVID and the times we're living in? I mean, just how much burnout do we normally expect in the medical profession anyway?
Well, generally, the OMA has done, last year they did a survey and they found that burnout in the profession was approximately 29%. March of this year, they did another survey, which was published in August 18th, and it was 34.6%. So during that time period, it went up 30%. Now, last week at the Hamilton Academy, we had a clinical day, and during that, we asked the same question: are you experiencing burnout? We had over 100 family doctors on board, and 71.9% said, yes, I'm experiencing burnout. So if you take a look at the numbers from March, which were 34.6%, to December, 71.9%. So you're looking...
Spell this out for me, is you gave us the percentage of people who are, quote-unquote, burning out. That's the percentage of all of the people currently working in the medical profession who say they feel that they're burning out, or is that a percentage of people who are going to get out of the industry?
No, that's people who are attending the particular conference. But I think it's reflective of many of the healthcare providers.
So how much worse is this situation as a result of COVID?
I think it can be related to COVID. So I think COVID, it's an overwhelming concern, and physicians are dealing with it on the front lines. We're dealing it with the impact of COVID. We're dealing it with patients that are sort of vaccine hesitancy. We're dealing with patients that aren't coming in for their chronic disease management. So there's many sides of it.
I guess the natural question would be, what is it we can do about this that would make the situation any better? Is it about adding more bodies to our medical profession? Is it about offering people financial incentives? Is there anything we can do?
Well, I agree with the OMA position, and one of the OMA's position is promoting integration of digital health tools into physician workflows, and also the greater use of remote patient management technologies, especially when it comes to chronic disease management. So we're into a new era, and we have to embrace technology, and we have to apply technology when it comes to patient care.
Okay, well, explain that a bit more for me. I'm guessing that, for example, somebody who's being treated for a cancer, for example, rather than having to haul their butt to the doctor's office or Princess Margaret, they could just hook up from their home on video, and it would be easier for everybody all concerned.
Yeah, for sure. Or post-surgery care. Why do you have to drive to see the surgeon? Why can't you just do a video conference? Or let's look at diabetes care. So diabetes care, historically, we do a finger stick at 7 o'clock in the morning, and you knew what your blood sugar was at 7 o'clock in the morning. But what's it at 8 o'clock or 9 o'clock or 3 in the morning? So now we have these new technologies where you put a disc on, and we know what your blood sugar is 24 hours. And the great aspect of this now, that information is in the cloud. So the physician can actually have a virtual appointment with you, and he's looking at your results real time. So why come to the office? Why take the time? Why fight the traffic? Why, it's not climate friendly. It's not time efficient. So it's an opportunity for us to do practice medicine in a new way.
All right. Well, it's going to be interesting to see how that unfolds. Thank you, Doctor.
And Merry Christmas.
Merry Christmas to you, Dr. Rick Tytus.
Booster shot.
Yes, I'm working on it. Thank you. Dr. Rick Tytus, Associate Clinical Professor in the Department of Family Medicine. He's at McMaster University.